Morning, everyone. It is 10 o'clock and we are going to start our coronavirus COVID-19 virtual information session. This is our third session and we're very happy to have a good group of people online. Thank you so much for joining us again. We have an exciting speaker who's going to talk to us today, Emily Beauregard from the Kentucky Voices for Health. Before I introduce her, I'm going to ask our medical director, Christian Furman, to give us an update, and just be mindful while she's doing the update of the best practices while we are doing this session. Keep your phone on mute, your system on mute, and if you have any questions, we will alternate between you can raise your hand or you can just type the question in the chat, and we will make sure that we answer all of the questions as our speakers talk. So with that, I'm going to hand it over to Dr. Furman, and I just want to tell you all that she's been doing an amazing job keeping the clinic going and making sure that our people are getting the services they need. So thank you, Dr. Furman.
You're welcome, and I'm happy to do it. Yeah, so I'm Dr. Christian Furman. I'm professor of geriatric medicine and palliative medicine here at the University of Louisville, the Traeger Institute. So I want to let you know what's going on in Kentucky and then specifically in our clinic. So as of yesterday, this is Monday's data yesterday, there were 480 total cases of coronavirus in Kentucky and 42 new cases yesterday. 17 of those cases were in Jefferson County, and we had 2 deaths yesterday from the coronavirus. So this is a real thing. We want everybody to be vigilant, but we also want everybody to still, have a normal life. So trying to balance those two things is, I think what I feel like is that basically we've gotten to a new normal. I feel like things are kind of gotten to a new routine, and we're going to get through it. So one thing that happened now is that University of Louisville, UofL Health now has a universal mask guidelines. So I want you to know that we are, as of today, starting to wear masks in the office. And these are surgical masks. They kind of go over the ears, the blue mask. They're not the N95 masks. The N95 masks are the ones that have like the duck bill, and they go above and on top of your head and above and below your ears. The surgical masks just kind of go around your ears, and that's what we have in the office. So the duck bill, the N95 mask, or if it's an aerosolized procedure, if you're doing a nasal swab, if people are coughing in your face and you know that they have coronavirus, that's the higher risk mask. But just the routine mask is the surgical mask. And so that's what UofL Health has recommended that we wear. And the reason they changed that is that, every day the knowledge about the virus is rapidly expanding and the guidelines keep evolving. And that's why, we're evolving with the new guidelines. And so the mask, this new universal mask approach will serve to, 1, protect our patients and other staff members should the healthcare worker have pre-symptomatic or asymptomatic COVID-19 infection or develop symptoms at work. So a mask achieves source control and decreases the risk of spreading the infection. And the second reason is to protect our healthcare workers should they come in close contact with an individual with either pre-symptomatic or mild COVID-19 infection or who has symptoms that have not yet been recognized. So, it's now that it's more widespread, you kind of have to think everybody has the virus. And so you want to have the mask on in case you have it. You don't want to give it to somebody else. And in case somebody else has it, you don't want to get it. And we're really trying to protect the healthcare workforce because there's no replacements for the healthcare workforce. So we have to have strict adherence to the reuse. So now everybody has a bag that has your name on it, and you put your mask in the bag. I had mine on earlier. I took it off. Now I have it in the bag, and I'll put it back on later. We have to wash our hands, before and after we touch the mask. And you cannot touch your face. You cannot touch the mask. So it's every day is a new challenge, and that's our new challenge for today. So I just don't want patients to be scared when you come in the office and see everybody with a mask on. It's just a normal part of our business operations now. And also, speaking of masks, there is the fabric mask that people are making on their own, or bandanas and all this. Those do not have the official protection. And so the CDC is not recommending those as first line. So we appreciate everybody making masks. You can go ahead and make the mask. We might actually need them at some point. Right now, UofL Health has done inventory, and we have enough masks to last 28 days. And we're getting new shipments of masks. Companies are making new masks. So we really want our workers and everybody to be protected. So we want to use the official masks. And the people that have the fabric masks that they've been making at home, you will accept those as donations. In case we have nothing else, it's better than nothing, but first line of these official surgical masks and N95 masks. So there is a mathematical model out there that talks about state by state what's going to happen with the virus and how it's going to play out. And the website for that is covid19.healthdata.org/projections. And if you look at that and you look at Kentucky, we're going to do well in Kentucky. I think it's because our governor and everybody's been following these good guidelines. We have flattened that curve. And it's projected that the peak will come in Kentucky between May 4th and 6th, about May 5th. And Kentucky is expected to have enough ICU beds and enough ventilators. So we're going to be okay in Kentucky if everybody keeps following the same guidelines and the same healthy at home guidelines and stay at home guidelines. So, so that's good. And that mathematical model is out there. If anybody wants more information, you can let us know. The big thing is don't travel, stay at home, especially our vulnerable older population. Stay at home unless you have to go out for essential things. Also, we are providing testing now at UofL Health for the COVID-19. We're not doing it in the office, but just about a block or two away from us, one of the buildings that used to be a Kentucky One building, used to be the old doctor's office building. It's where I first started our practice in geriatrics. So some of our patients will know that building because that's where our office was about 20 years ago. The parking lot beside that building is where they're doing the drive-through testing for UofL Health patients. And we're only testing patients if you have a doctor's order or provider's order. So if you're overall healthy with mild symptoms, we're asking you to stay at home. But if you are a high-risk patient, like if you have lung disease, diabetes, heart disease, and you have symptoms, you know, fever, cough, shortness of breath, chills, fatigue, or you're a high-risk patient with direct contact with someone that was COVID-19 positive, you need to call us and we'll connect you with the triage testing line and they'll give you an appointment and then you go at your designated time to get tested. We don't have that open on the weekends. That's just Monday through Friday. But our office has 24 hours, 7 days a week answering service. We always have somebody on call. So you can always call our office for any questions, and that's 588-4340. So I wanted to make sure I covered everything. Let me just make sure. I think, oh, the other thing I want to talk about is the visitation policy at UofL Hospital. Each hospital has its own policy, so you have to call ahead to make sure. But the UofL Hospital and UofL Health, all the hospitals in the UofL Health system, Marion Elizabeth, UofL Health Shelby County, and UofL Hospital. In the emergency room, they'll let no visitors back in the emergency room. Once you're up on the floor, you can have one visitor. And if you have an end-of-life situation, someone that's dying, you can have 2 visitors. So it's really hard for families and patients because you can't have enough, you know, not as many people around. And I actually rounded at UofL Hospital on Friday. It was my first time there in 2 weeks. And it's just very quiet at UofL Hospital. There's not as much there's no elective surgeries going on. There's not many people seeing their doctors in person. It's all telehealth. So it's just very kind of eerie and quiet. So it's just a different world. Our clinic here is open for business at the Optimal Aging Clinic from 8 a.m. to 12:30 p.m. every day. We're on a skeleton crew, but our lab's open. You can do a urinalysis. You can see a provider in person. The rest of our visits are doing by telehealth. So all day long, every day, we have multiple providers providing telehealth visits. All the providers are on their same schedule except providing telehealth visits. That's going really well. We're using Blue Jeans. We're using FaceTime. Where sometimes if we can't use any of the above, we're just calling the patient the old-fashioned way, and it works really, really well. And it's kind of like doing a home visit. In geriatrics, we love doing home visits and seeing people in their home. And I saw a patient last week, and behind her, she had her bookshelf, and she had her Gold Standard Award for Optimal Aging Luncheon certificate there that I could see. So it's really neat kind of seeing people in their own homes. So please, you know, reach out, let us know, and we'll get you on the schedule for telehealth. And so I think that's what I want to talk about. Maybe teletherapy, we can have another provider talk about, but I'll leave it for now.
Yeah. Thank you.
Dr. Furman?
Thank you, Dr. Furman.
Yes.
Sorry, is someone asking a question?
Yeah, Dr. Furman, this is Sam. There's actually a question in the chat, and they're asking, can you address the current use of 2 antibiotics in our local patient population, Z-Pak and hydroxychloroquine sulfate?
Yeah, so, we are not treating patients that need to be treated for coronavirus. It's mostly symptomatic treatment in the hospital. They are using sometimes antibiotics like a Z-Pak. The hydroxychloroquine is also called Plaquenil, and that's, like a medicine that we use for rheumatological issues, but there has been some evidence showing that it works for patients in the hospital. So that's not an outpatient medicine that we're going to be using. It's going to be a medicine they're going to be using in the hospital if patients are sick enough to be in the hospital. So those are medicines they are using for coronavirus, but there's nothing been proven. There's no evidence-based research. This is such a new virus. We don't know. There's lots, we're using reports from China and other people that have had it longer than the United States. And so some people are responding to that treatment, but then some people aren't. What's happening for patients who are scheduled for new patient visit during the month of April? So yes, so we are keeping all of our new patient visits. We're calling each person and giving them the option to change it to a telehealth visit at the same time, or if they want to come in, they'll see a different provider. So on Wednesday morning, Dr. Jessica Dow is seeing the inpatients in-house and physically seeing patients here for new patients. And Thursday morning, our nurse practitioner, Angela Leinenbach, is seeing the new patients. So we actually have more room on our schedule now for new patients. And so we're willing and able to see the new patients. Medicare used to say that new patients had to be seen in person, and now they're letting us see new patients as a telehealth. So it depends on the patient, but we're trying to move everybody. It's usually better in person, but with our frail population, it's okay to keep it as a telehealth visit. It's up to the patient. And so we're calling all of our patients and reaching out. And
thank you, Dr. Furman.
Yeah.
I'm going to ask that we deal with all the questions after Emily has done her presentation, because she has some limited time. And I just want to add to what Dr. Furman said, is that we are seeing a lot of calls coming into our clinic of older adults who are lonely, isolated, and depressed, and not only just older adults, but really just a lot of our patients. So we have opened up the schedules of our therapists to start also doing group therapy. We will have a group therapy session on Monday afternoon at 4 o'clock and another one at noon on Wednesdays. And we have our Florida Care specialists are doing the PILS program also with people who want to join and get some support just to deal with the anxiety and the stress associated with being alone and not being able to visit with people. So please reach out to us. Our clinic number is 588-4340. Therapeutic interventions. So with that, I am going to introduce you to Emily Beauregard. She's the Executive Director for Kentucky Voices for Health since 2015, after years of active Health Coalition membership. Under her leadership, the coalition launched the Ensure Kentucky campaign to preserve Kentucky's successful Medicaid expansion and advocate for more affordable coverage, better care, and stronger consumer protections for all Kentuckians. Emily holds a master's degree in public health from the University of Illinois at Chicago, and she's going to share with us some policy and resource updates for the state of Kentucky that will provide more support to individuals as we manage the COVID-19 pandemic. Thanks, Emily, for being with us, and it's all yours now.
Oh, well, thank you very much, Dr. Fall, and thank you all for having me today. I really appreciate having the opportunity to share some information with you about what we've been doing at Kentucky Voices for Health to support consumers. And consumers, of course, are really the general public, all Kentuckians who need access to affordable health care and need good, plain language information about where to get their care, how to navigate the healthcare system. And so I wanted to start by talking about some new resources that we created recently in light of this COVID-19 pandemic, so that people could have a good go-to source that provides information on the public assistance benefits that are available to them. So I think that this may be something that is going to be available in the chat, or somehow links will be sent to you. We have two pieces that we've been sending out. This is One has a bar across the top, and it says "Help for Kentuckians During COVID-19." And I'll talk about that one first. We call these explainers because what we're attempting to do with them is really make them take all the information out there. And I think we can probably all agree that it is just an overwhelming amount of information. And at the same time, it can be really hard to understand what it all means for you as an individual, for your family, for the people that you're serving, how to kind of distill that information down into something that's meaningful, that's actionable, and that people can use in order to get the services that they need. And so this was created as an explainer that could be either sent electronically to people or printed out front and back and handed out in the community. And we would encourage you to do that. We'll be updating it as new information comes out, of course. And this is updated as of yesterday, and we're sending them out later today with Spanish translations. So we were excited to have the opportunity to do that. But what you'll see here is that we're really encouraging all Kentuckians to check to see if they're eligible for public assistance. And that includes things like Medicaid, of course, for your health insurance, access to healthcare services without any cost sharing, SNAP, which is food assistance, WIC, which is a program for women, infants, and children. That's what WIC stands for, but really for pregnant moms and for families with kids under the age of 6. Nutrition assistance is a big part of that program. And then there are other programs that the Cabinet for Health and Family Services, Department for Community-Based Services operates as well. Things like KTAP, which is cash assistance, and child care assistance as well. So what we want people to do is check to see if they're eligible, because a lot of the guidelines or the usual rules around these programs have changed during this period. The governor has been putting out executive orders and some emergency regulations, and some of those have kind of suspended the usual rules and also expanded eligibility for these programs, in particular for Medicaid. And so people who are typically not income eligible for Medicaid may be income eligible now because they've expanded that eligibility. They haven't given us like an upper limit cap. So that's why we're telling people you need to reach out, try to apply or call and find an application assister who can help you and see if you can enroll in that if you're uninsured. We currently have 223,000 Kentuckians without health insurance. And during, at any time, these individuals are at higher risk because when you don't have health insurance, you're less likely to seek care when you need it, especially, the preventive care, the chronic disease management. You wait until it may be an emergency. But right now, it really puts everyone at higher risk if people are delaying care or avoiding going to see a doctor when they need to or get the treatment that they need. And so we want to encourage everyone, all 223,000 people, to enroll in coverage. We also know that when people lose their jobs, which tens of thousands of Kentuckians recently have, they're likely to also lose the health care that came with that job if it was one of their benefits. And so again, another reason for people to enroll in Medicaid. So that there's information here and live links that people can use to just more simply access those services and learn about what's changing. And what's important for people who already are on public benefits, all of the benefits that I mentioned that are under the Department for Community-Based Services, they are extending those benefits by 3 months at least. So people who would have had to recertify, by the end of this month, for instance, will have another 3 months of benefits. They do not need to call to do anything to activate that. This is happening across the board. It's automatic. And we're telling people that because we're trying to cut down on the number of calls that the cabinet is taking now. They're being crushed with, people who need benefits. And so we're trying to make sure that we're using the cabinet staff wisely and getting new people signed up for benefits. I also wanted to let everyone know, this is something we've been working on for over a year now, copays in the Medicaid program are no longer being charged, period, across the board, no services. And there are no prior authorizations required right now under Medicaid. So that's a big change that people need to be aware of. It should help people get more of the services that they need, because it just reduces those barriers. So there are some good tips on this sheet. Unemployment insurance also has expanded dramatically to include more people who are typically, self-employed or are on contract in some way. And so we want to encourage people that if they've lost job, even if they've lost their job, even if they've lost just hours at work, they're still employed, but their hours have been reduced, they can apply for unemployment insurance. And that's really, really critical right now. There have been some bills that have expanded the benefits for unemployment insurance as well. And I'll talk about that in just a minute. But then on the back of the explainer here, you'll see information about the stimulus payments that are coming down from the federal government, and also where people can get help if, for whatever reason, going through the Cabinet for Health and Family Services doesn't get you where you need to go. And then the important hotlines and different ways to stay connected and get information. The other handout that we created is one that says what Kentuckians need to know about COVID-19. It's kind of a combination between having like FAQs, frequently asked questions, and having talking points that you can use in your community. We tried to make this very plain language, easy for people to understand, and a little bit more relatable than some of the other information that I've seen out there. And so you're welcome to use those in various ways when you're educating people in your community. We know that a lot of people are taking this very seriously, which is why, and our governor has provided great leadership. I think that's why we have seen the curve flattening, as Dr. Furman had mentioned earlier, and we've had good success at this. We don't want to let up too early. I think it's really critical when people, hear that we're doing such a good job, that we don't have as many people being either testing positive or in the hospital or dying as we do in our surrounding states. That's because we're taking these guidelines, the precautions, so seriously, and we need to continue doing that. Because we're flattening the curve, our peak is going to happen later. It's likely to, I think the projection is early May now, which means that we're going to be at this longer, the social distancing, the healthy at home. We're going to be doing this longer, and people need to understand that. And we're going to have to keep reinforcing the reason that it's so important that even if they don't have symptoms, even if they don't know people who have symptoms, they could still be a carrier, and they need to treat themselves like they could infect others, and vice versa, that other people that they come in contact with who may not look like they're sick could infect them. So we need to continue that drumbeat of education and encouraging people to be healthy at home. And so that's what that document is there for. So I wanted to share just really quickly, so much has happened with both state and federal policies. And I wanted to give you a little bit of a brief overview of some of the things that are changing because of these policies. You have probably seen some of the executive orders that the governor has put out, and there are some emergency regulations. The governor, really early on actually announced that there would be no copays for COVID-19 testing. And now through a federal law that has been, actually codified. So we now know that testing is free. Now, as far as treatment goes, a lot of the commercial insurers are saying that they're going to waive cost sharing for treatment. That's not across the board, but hospitals and federally qualified health centers and other safety net providers are getting millions of dollars, hundreds of millions of dollars really in federal funding. And so we're hoping that that will go to the type of charity care that you would want to see in a crisis like this, where, if someone doesn't have the type of insurance that's going to waive their cost sharing, that the hospital will have some funding in order to do that. And if that's not happening, if you hear stories of people who are being charged exorbitant amounts of money for treatment for COVID-19, we want to hear those stories. So that's something that we use for our advocacy. So please share those with me if you hear of those things happening in your community. Something else that our state has done, they've applied for, and it's been granted, an 1135 waiver from CMS. So that's for Medicaid, and that gives them great flexibility in terms of provider enrollment. Typically with Medicaid, it can take months to be enrolled and credentialed with various MCOs, and there are also different rules, of course, if you're a provider licensed in one state and you're trying to practice in another. And so this waiver gives the state incredible amounts of flexibility so that they can enroll more providers in Medicaid, and that these providers can operate, in places and facilities where they haven't been typically. This may even end up being people who have retired, or people who are, going to be working across state lines. And then they've also greatly expanded telehealth. And we've heard telehealth mentioned a lot today. It is the new normal for now. And access to either your usual chronic disease management, or, if you just need a checkup for one reason or another, telehealth is really the name of the game. And having access to behavioral health services during this time is really critical. So telehealth has been expanded to make sure that that's available. So all of these things are happening really quickly, but we know that the different licensing boards are trying to get these things in place so that their providers can kind of make this shift and continue to serve their patients and new people as they need new services. So something else that I thought I would mention is that the governor has suspended evictions, which is actually really important right now whenever we want healthy at home. And new funding that is going to be coming down from the federal government again through the new laws that have been recently put into place will be providing more for homeless and housing services. Probably not enough still, and obviously not as soon as we needed it, but these are things that are starting, pieces of the puzzle that are starting to be put in place. Just a few other things about what's happening at the federal level. There have been two major bills. The first was the Families First Coronavirus Response Act, and that increased our Medicaid match rate. And what that means typically is, Kentucky gets, when you combine Medicaid expansion with traditional Medicaid, we get about 80 cents on the dollar for our Medicaid funding. So for every dollar we spend, the federal government picks up 80 cents. Now that's being increased by 6.2 cents, essentially, under that act. We need it to be higher, so that's an area where we need to continue to advocate. The recommendation has been an increase of 10 cents. So something else that act did was increase assistance for food aid and also suspend the work reporting requirements for SNAP. And that's really critical because these work reporting requirements, while we know people are typically working, they're working in multiple part-time jobs, or there are various other reasons that reporting work is just really tough, and people end up either not knowing how to or being late in reporting, all sorts of reasons why it creates an additional barrier for folks. But over the past 2 years, at least 30,000 Kentuckians have lost their SNAP benefits because of this requirement. So now that this requirement is being waived, we hope that we can get those individuals enrolled again. And there are going to be more people who are eligible now that they've lost their jobs. So having additional funding there is going to be really critical, and having fewer of those barriers. The CARES Act was passed just last week. This is the next big bill. It was the biggest relief bill in history, actually, in our history as a country. It's about a $2 trillion bill, And this allocates $1.7 billion of relief funding to come to Kentucky. About $134 million is coming to Louisville specifically, and the rest will be allocated in different ways. There's kind of a funding allocation formula to different areas of the state. We know that that enhanced Medicaid match is bringing in an additional about $480 million to Kentucky. And so this is revenue that Kentucky can use to respond to the pandemic and also to plug the holes that we're going to have because so many people have lost their jobs and will need additional assistance. And then I mentioned again that unemployment benefits have been extended from 26 weeks typically to now 39 weeks, so a 13-week extension. And for 4 months, people will get an additional $600 per week, which is really significant. It's going to help a lot of people make ends meet during this time. There's an expansion of paid sick leave and paid family leave, but not nearly enough, not to all workers. And it is specific to COVID-19 related issues, so not across the board. So that's another area where we need to continue to advocate. I think this pandemic just demonstrates exactly why we need paid leave, why people need to be able to make those healthy decisions for themselves and their families so that they're not putting everyone at risk, including themselves. And so I think this is going to be a long-term fight. There are going to be these direct payments coming to Kentucky. The thing that people need to know in your communities is that they have to have filed a tax return in 2018 or 2019 in order to get that payment. So that's really critical. These payments could be coming within just a few weeks. So if you can get that message out, that will be really helpful to people to get those payments. And they could come either electronically or via check, depending on how they file their taxes. And then, of course, there are lots of, there are small business loans that are going to be available, and they will even be forgivable if people keep staff on. And while they're called small business loans, they will also apply to many nonprofits. So that's really critical. Nonprofits need to know what is available to them and to be able to take advantage of that assistance. And then there'll be, like I said, lots of funding for hospitals, for federally qualified health centers. Whether it's enough, I think is still in question. And there may be another phase of relief that we're going to continue to have to advocate for. But these are the things that we're starting with, and we think that it's a good start. I think that covers the basic points that I wanted to make. I know we don't have a ton of time, and I want to make sure that I can answer questions. The last thing I'll say in terms of advocacy is that the legislative budget, Kentucky's budget, is still being worked on in our General Assembly. We expect that there may be a vote on it tomorrow. That's what I've heard. And one of the things that's been in question that we've been very concerned about is the pension contributions for our quasi-governmental organizations. And those are, the community mental health centers, rape crisis centers, domestic violence shelters, really critical services at any time in Kentucky, very critical safety net programs, but now more than ever, we need to make sure that they can continue to operate. And those pension contributions have been a huge burden on these organizations and have made it, difficult for them to really address full needs in their communities. And so that's one area where, depending on what we see in that budget, we'll need to continue to advocate that they have relief from that burden, so that they can continue to operate during this time. All right, well, I tried to cover a lot.
Thank you, Emily. Thank you, Emily. We really appreciate everything that you shared with us. We have 2 more questions for Dr. Furman and then a few for you as well. So I'm gonna ask my host to start asking the questions. Let's start at the top and address it in the order they were asked.
Okay. Would you like me to, I'll start with Ruth Newman.
Yes.
Okay, hold on just a second, I'm scrolling. Okay, so can people protect each other by wearing a DIY mask so that I protect you from droplets and you protect me from your droplets, and what's the best material? I think
So yeah, this is Dr. Furman, and those do-it-yourself masks, they've not been studied. There is no best material except the material that's officially in our surgical mask, the COVID or the N95 mask. So, you know, if you have absolutely no mask, they're saying the bandanas or the homemade mask are better than nothing. But we do have masks at UofL Health, and they are not right now recommending just the general population to wear masks. I mean, that might change. The CDC guidelines change every day, but right now the recommendation is not for everybody just walking around town to have a mask. The recommendation is to stay home. Everybody should be staying home. That's why the recommendation is to stay home, so we're not passing it around everybody. And you need to be 6 feet away from people. You need to wash your hands for 20 seconds. So you have to really count to 20. It's hard to do 20 seconds of hand washing. And you know, just keep checking the CDC website about the homemade mask. But I don't know of any that's not recommended at this point.
And Michelle asked, and if I butcher your question, I apologize. I work in advanced heart failure, high risk. If we have patients with symptoms or are going to be in direct contact with positive, can we send them to, is it probably drive-through testing?
Yeah, so if you have high-risk patients that have been in contact with someone, or if you have patients that have symptoms, the fever, cough, shortness of breath, yes, we do want to send them through drive-through testing, but they have to get an appointment. And so let me pull out the phone number because you have to, the Access Center is able to set up appointments, or they can contact their own primary care provider at UofL Health and they can get the appointment. But the triage line is 588-0401. That's for clinical offices. That's what we're supposed to do, is call. If you, if the Access Center is going to call, then they call our office, and our office calls the Access Center.
Thank you,
So
Dr.
does that make sense? Yeah.
Thank you, Dr. Furman. So you will see in the chat that I
Thank you.
uploaded the handouts that Emily was speaking of. These will also be on our website after today's session. Dr. Fall, did you have something to say?
No, I just want to say that I think those are the questions for Dr. Furman, and we're moving over now to Emily's questions.
Yes. Okay, so Jennifer Boone asks, does the Medicaid 3-month extension apply to someone whose recertification is due today? They would have received their information in the mail in February, when unable to get documents in the office due to someone in the home being diagnosed with COVID-19. The local worker told them that they may lose benefits for the month of April. Is there someone that they could contact regarding this individuals in Bracken County?
My understanding is that even though they may have gotten, you know, the restart information back in February, that the state has gone ahead and done that recertification, you know, the 3-month extension for everyone across the board. So I would say I'm, you know, 99% certain that that would apply to this person. Now that, you know, sometimes people fall through the cracks, and if they do lose their coverage, I think that they will more easily be able to get re-enrolled than maybe, you know, in previous months. So the state is really doing everything they can to make this a simplified process and much more streamlined than it has been in the past few years. But that said, if they really want to know, I would say they would probably have to either ask an application assister to look at it in their Benefind information, or they would have to call DCBS. But I feel pretty confident that it will be extended for them, as well as anyone else who's currently enrolled with Medicaid. That is really the goal of the Cabinet for Health and Family Services right now, is to not disenroll anyone. And in fact, these new federal laws, the first one, the Families First Coronavirus Response Act, with that additional bump in the federal match for Medicaid, one of the strings attached, which is a great string in this case, is that the state actually cannot, if they take that enhanced rate, they cannot disenroll anyone from Medicaid unless the individual asks to be disenrolled or moves out of state. And so while we're saying it's a 3-month extension across all benefits for Medicaid, it will actually be an extension of coverage until the emergency ends. So the state of emergency that we're currently in, Medicaid will not disenroll anyone. So hopefully that's helpful.
So Barbara asked, does the extension of recertification apply to Medicaid waiver also? And if so, what happens to those who were in the process of recertification? Will temporary employees be covered by unemployment?
So in terms of recertification, it absolutely covers Medicaid expansion. At this point with this administration, there is not a difference between the type of benefits or the way that Medicaid expansion is being treated compared to traditional Medicaid. Everyone has Medicaid and is eligible for the same benefits, has the same requirements. They're not making a distinction with this administration like we saw in the past Bevin administration. So yeah, it applies. Let me see that second question again. I know that was a double question. Will temporary employees be covered by unemployment? I don't feel qualified to answer that question. Hopefully there's information that you can get from the Kentucky Career Center. On the handout, there's a link. I think there are some different factors that play into whether or not somebody is eligible for unemployment insurance.
Thank you. So I see a couple of questions for Dr. Furman. I'm going to ask the questions for Emily and then I'll scroll back. Emily, is this a good time for people to contact their legislatures about the budget so that health departments, mental health centers, and rape crisis centers are also supported?
Yeah, I think so. I mean, we have a very small window of opportunity right now with our state budget. And because, I think it's been 2 weeks now that the Capitol and the Capitol Annex have been closed to the public, and for good reason. That was the right call for the governor to make. But the fact that our legislature has continued to meet has made it very difficult for the public to be involved in the budget negotiations. And calling your legislators and letting them know that this is not the time to increase the pension contribution or even unfreeze what we currently have is really critical. And I'm sorry that I didn't mention local health departments earlier because obviously we need our local health departments now more than ever. And we need to advocate not only for, freezing the pension contribution at this point, but ultimately for providing more funding to our local health departments so that we can be more prepared and more proactive in the future for crises like this.
Okay, I think that's all the questions for Emily. Does anybody have any other questions for Emily? Okay, so I'm going to scroll back up to the questions for, I'm assuming for Dr. Furman, but let's see. Dr. Furman, if can a patient go to UofL Health even if they aren't established patients with their primary care providers there?
So I think I saw that one from Michelle and saying that you work and you send patients to this triage line even if they don't have their PCP with UofL Health. If they have any association with UofL Health, you can use this line. I'm putting the testing triage line in here. That testing triage line is for clinical offices only. It's not for patients to call directly. So like our office can call and give an order. They have to have an order. They have to have a provider's order. But, I think, Michelle, you're saying that you work at a UofL Health facility at Jewish. And so you are a clinical office. And so you can call and get your provider to write an order for that patient to get tested. So I think that hopefully that answers your question. I mean, it doesn't have to be just primary care practices. It can be anybody associated with UofL Health can call that line and get an appointment for a patient to go.
And so this is from Colby. Is there a period before which a test will or can produce a false negative?
Yeah, Ruth Carrico was on last week. She's the infectious disease specialist at UofL Hospital, and Dr. Carrico talked about this. She's a PhD, and what they're finding with the infectious disease department, they're doing some of these swabs and they come back negative. It's because the virus has already moved. The swab is the nasopharyngeal. It's doing a swab up your nose or in the back of your mouth, But what happens is the virus then moves into the lung. And so sometimes you can do a swab up in here and it's negative, but to really get the testing done, you have to do a bronchoscopy, like a scope into the lung, and that will show the virus. And it's just like any testing, it's not perfect. And maybe you didn't swab the exact spot where the virus was. So just because you have a negative test, I mean, sometimes if people clinically have the disease, you know, we didn't have any testing at first, right? So we were treating people clinically from day one. So people are being treated clinically that might not have a swab that comes back positive. And there's a delay in getting back the results. And so, you know, we just have to treat people clinically with what their exam and their x-rays and their other lab findings go along with the disease. So test plus clinical diagnosis, right? It's a clinical diagnosis right now. And we do the testing if you have these symptoms, but it's still such a new virus that we're not understanding all the ins and outs of it. You know, some people are just manifesting as diarrhea. And so like, there's no upper respiratory symptoms. So it might be that they're not going to be able to even get a positive through the upper respiratory. I haven't heard that they're testing stool samples, you know, for the virus if it's only diarrhea. So I just don't think we know enough at this point about this virus. And I think somebody else was asking about the mask a little bit. You know, if I wear or the homemade mask, I wear a mask, you wear a mask, we're all safe. There's not official guidelines with that right now. The official guidelines are, you know, nothing with the homemade mask. The official guidelines are staying 6 feet apart. So, you know, if you stay 6 feet apart, you really shouldn't have to wear any kind of mask, just in the general population. And if you're working in a healthcare setting, you know, you will be provided a mask by your supervisor.
So someone asked, what is the proper cleaning required in an office space where someone has been tested positive, and how long should people stay away from the building?
Yeah, you know, I think each building is going to have to tackle that. It depends on where it was. Like UofL Hospital has policies on how they're cleaning their buildings. So I don't know if I'm qualified to answer that. You know, like I think some buildings have shut down and emptied the building and done a deep cleaning. But you have to definitely wipe off all the surfaces. And UofL published the exact cleaning solution. I don't have it off the top of my head. So yeah, if you're trying to specifically clean out a building, you need to check the CDC guidelines. And Dr. Joe said something here. Joe, you want to say what you were saying?
Yes, what I just posted. So what UofL is using is Virex Plus, and I put it in the chat. And it's a spray, you leave it on for a certain amount of time. So I think there are a number of sprays on the market right now that are able to kill viruses. And they're recommending, this is what UofL is using right now. Virex Plus.
Yeah, Joe's in touch with our cleaning crew, so thank you, Joe.
Is there any more questions? I'm not sure if we missed anyone, but is there any more questions that anyone needs to ask? Okay. It looks like most of our questions have been asked and answered, and I want to thank Emily and Christian for being with us on the call and provide some great information. Again, we will be saving all of this information that was shared in the chat on our website and on our blog. It normally becomes available in about 2 days from now. So thanks everyone for being on the call again. It was great meeting with all of you, and until next week, and stay safe and isolate yourself.
Yes, we're going to get through it, everybody.
And yes, you can share anything you want with students or anyone asked by Dana. Thank you. Thanks everyone.